I'm Eric Parker this morning on CT22. It's a new year with new concerns about COVID. Hospitalizations are at levels not seen since the early days of the pandemic, and people worried they have COVID are waiting in line for hours to get their hands on those at-home test kits. DPH Commissioner Dr. Manisha Juthani is giving us an update on what's happening in our state and offering thoughts on when Omicron could end. Plus, how are those on the front lines faring as they battle yet another wave? We'll get insight into how Connecticut's nurses are doing and what's being done to help them. We'll also check in on the state of our schools with Omicron in the picture. And cloth or surgical masks, they don't offer the best protection needed to keep Omicron at bay. We're talking to the self-proclaimed mask nerd of YouTube about which masks he recommends. It's all ahead this Sunday, January the 9th. CT22 starts right now.
From WFSB, this is CT22 with Eric Parker, sponsored by Hartford Healthcare.
Good morning, and thank you for being with us. The Omicron variant is here in Connecticut, of course, and it continues to stir up trouble here. Hospitalizations are at an all-time high. The positive case count has reached numbers we haven't seen before. Here to give us an update on this COVID surge is Dr. Manisha Juthani, Commissioner of the Connecticut Department of Public Health. Dr. Juthani, thank you for being with us. I think we all just see these numbers and the percentages. They're climbing and climbing. Should we be worried?
I think people have to remember a few things. First of all, we're in a much better place than we were at the beginning of this pandemic. People who are vaccinated and up to date in their series of vaccinations, which includes a booster, are largely protected. People are having mild cases of disease, sometimes are even asymptomatic. However, if you are unvaccinated, I'm sorry to say that you should be worried because COVID-19 is still a very serious illness. And although people are hearing that it is milder, most of the people in the hospital right now are those who are unvaccinated.
We have seen those percentages climbing, the test result percentages, the number of cases, the number of hospitalizations. But even on an anecdotal level, a lot of people have said they just simply know more people who have had COVID. I know personally, I know more people who've had it in the last 2 weeks than in the entire previous part of the pandemic combined. So from a professional perspective, you're looking at the nitty-gritty data. Does it jive with what people are just feeling, like there's just more of it out there?
There's no question. The data actually supports exactly what you're saying. We are seeing case positivity rates 20+% with, as you said, people knowing people who have been infected. This is all reflective of the Omicron variant, which is much more infectious. This is what viruses do over time. They want to survive. They become more infectious, they infect more people, and they become less virulent over time. However, we really know that vaccination is the best way to really shore up your immunity to make sure you don't have a severe case, even though we're seeing a lot more cases in our communities.
Now, certainly vaccination makes this wave a little different perhaps than some previous waves, but what also makes it different is the ability to do at-home testing, which we didn't see even just a few months ago. At the end of last year, there was that much publicized little bump getting started with it, but now those at-home tests are out there. Is that a helpful thing from a public health perspective? And what do you want people to know about the ability to test at home?
So this was an initiative we really tried to push out to be able to give people another way that they can know that they are positive and that they should stay home. And the reason is we know that even though we stood up 23 testing sites in the Delta wave, and they weren't that busy over the last several months, all of a sudden we've seen such an expanded need for testing. And self-test kits are helpful because if you're sick, and you can do something within the confines of your home and know that you should just stay at home, it's an easier way to keep people who even have mild disease, a cold, something along those lines, at home and prevent from spreading the virus further within our community.
Do those numbers from the at-home test kits show up in the numbers that the state's putting out? Could it actually be that it's quite a bit higher than what we're putting out because people are just testing at home, getting that result and saying, geez, I guess I better stay here for 5 days?
So we do not require any sort of reporting of self-tests into the test numbers that you see in terms of our positivity number. So one thing we have to remember is that those tests are neither in the numerator nor in the denominator in terms of number of tests. So it's very hard to know, are we exactly at that number or are we up or down? I think the main thing to know with test positivity is we are very high. And that is reflected in what everybody is seeing among people that they know in their communities. And people have to just keep that in mind.
Yeah, no doubt about it. Schools, another big topic, and what should be done with schools. I know a lot of schools have shifted based on some new guidance to maybe do less on the contact tracing side and a little bit more on kids with symptoms. What are you telling superintendents who are calling your agency looking for advice?
We work very closely with the Connecticut State Department of Education, who is largely fielding those calls, but we work in collaboration together to be able to help answer those questions for superintendents, teachers, and families. And what we have to remember is we saw success with Screen and Stay in the last several months that we had before this new guidance. We also know that in-school transmission has generally been very low. And what we're capitalizing on now is asking school nurses or giving schools the option to recalibrate where they put people's efforts so that school nurses can spend more time, instead of figuring out who was 3 feet and 6 feet sitting around the infected kid, to put those measures in place that keep the school overall safe and ensuring that kids that are sick actually stay home.
I know a lot of your job, we've talked about this before, is not so much the micro, but the macro. So how's the system handling this surge? I know there's a website a lot of people have looked at. Alexander Chen put it up, and it looks at if you're in good shape, if you're overwhelmed, or if a circuit breaker is needed, some sort of short-term measure. He's got Connecticut in that circuit breaker category, not overwhelmed, but not doing great. How do you view it?
We recognize this, have been meeting with our hospitals regularly and all the different health partners within our state, including federally qualified healthcare centers taking care of some of our most vulnerable patients. And there are things that we have done with collaboration with all of them, whether it be to increase testing sites, whether it be to ease some of the insurance issues in terms of helping patients get transferred out of the hospital, whether it be looking at telemedicine and easing some of those restrictions, allowing for providers that have out-of-state licenses working within our state, allowing for some of that ease of licensure requirement. These are just some examples of the various things, including getting our National Guard to help in a number of different locations. And we continue to assess this on a daily basis.
Just 10 seconds left, Dr. Juthani. What's the big milestone people should be watching for where maybe they can take at least a little bit of a breath?
We really need to see what these next several weeks are going to look like. I think we're going to see Omicron really overtake our community. We're at 91.5% Omicron in the state of Connecticut. Let's see where we are. I hope this summer is going to be much better.
All right, Dr. Juthani, the Commissioner of the Department of Public Health, thank you once again for being with us.